the Omnicell room. This is where everything that we use is stored. You want to come on in here. So I'll try not to be too over the top, but just to kind of give you an idea of where things are at, because that's the number one thing new people have trouble with, is finding. So we've got our oxygen tanks back here and back here. These ones are the ones that are full. These ones are the ones that are either already open or expired. The tag will be ripped off if it's no longer good. The Omnicell is divided into different areas. Kind of everything that needs to be near other things should be fairly close by. So here's like hygiene items, so wipes and things for getting ready, like slippery socks and shampoo, and the buckets for admission. I'm going to just show you real quick. I'll grab you our typical admission stuff. So on an average admission, we're going to grab a bucket, and depending on the age of the child, some wipes. Under a year, they're going to get a head circumference measured, and everybody should get a weight. If it's impossible to get a weight, you can wait until they're after post-op, and then we could get it the next day, but ideally we want a current weight. This next column is for, this is like the stocking stuff for the ward clerks, and then down here are syringes for G-tubes and feeding, and then it'll say gastro here. This is all your enteral tubes. We're currently using the Medela orange system, so we are having a little bit of trouble with the connections, but there is always a Toomey syringe that can combine both of the tube types. Then the dressings go along here all the way through, and tape. And then down at the bottom you'll have your hot and cold packs. Up here you've got your oral syringes for medications. Diabetic care here. Any of your lab stuff should be here, other than the lab tubes that'll be in the back Omnicell. All your Billy Baby equipment is here. The NG suction and the suction equipment is here with the suction canisters. And then over here, I'm going to switch sides. This is all your feeding stuff for babies that are feeding. We are a baby-friendly hospital, so we want to try to encourage the baby-friendly principles. Up here is all your oxygen and respiratory equipment, spacers for albuterol. Down here is some other respiratory stuff like suction, and then the leads and probes for doing vitals. So let's say we needed a blood pressure cuff. The leads, we usually put everybody on the 3 leads, so even our bigger kids, it's just really nice to be able to put them on 3 leads. We don't do telemetry here, but if you did have a kid that was older, that was a cardiac kid, you'd want to put them on the 5 lead. Discharge bags and other types of bags are down here at the bottom row. And then over here, we've got all of our new IV tubing that go with our new pumps. So it's kind of mix and match right now. Once we get it organized, what we're using exactly, we'll put them all together up above. And then we've got trach care. Moving on over here, we've got the labels for your IV bags. Your IV bags are here. If you can try to grab your label right when you grab your bag, that's the best thing to do. All the PPE is here, so cleaning stuff goes here. We have, for our respiratory season, we've got stethoscopes for our respiratory kiddos. And then the gloves, we use those for restocking all of the PPE bins. Diapers are over here, and Chuck's pads are right here. And all the urinary stuff is in this container. And then up above is all the gastrostomy care. Foley's are there as well. And then this again is for the ward clerk, all the labels. Behind you, if you want to turn around, is all the linen. So we don't have the fabric Chuck's pads anymore, but we do have thicker ones that we can use. We're going to get them stocked here. Currently we're getting them from the PICU. But this is all your blankets and everything, and then we just want to make sure that it stays zipped when we're not using it all the way to the floor. And then just remembering that nothing should be 2 feet above any of our ceilings. Should we have things that are touching. So if you want to come this way, I'll show you the back Omnicell. This is the back Omnicell room, if you want to come in here. This is also our treatment room. So this is where we do procedures on our children. If we can try to not do it in their beds, that is ideal. Sometimes being in isolation, that doesn't work so well. But a lot of our IVs are done in here. This is also the respiratory closet for our respiratory therapist. So if there's a few things that you're missing that you're not sure of, you can look here. It goes like that. If you have a patient in here for an LP or a procedure, you should try to have them on the monitor. Just be aware of what the settings are that you set. And then if you can turn around here, this Omnicell has all of our equipment for starting IVs. It's where we restock the medrum for the syringes and for our lab, or our tubes for our labs. And then the LP kits are up here, blood cultures, all your sterile gloves are in here. All the dressing changes for the central lines are over here. We try to stock things in this drawer area for easy grab. One of the things that we do use down here are our flushes that are in here. There shouldn't be any Sharps products in here. Those should all be locked up. And then there's some tubes in here. Where else can I tell you? Now let's go this way. The scale is in here for grabbing for admissions.